Hello, FHA members. We are launching an exclusive monthly update for member hospital CEOs where we will share high-level insights into the latest developments impacting Florida's hospitals. First, I want to share that FHA wrapped up a very successful retreat with our Board of Trustees last month. We had robust presentations and discussions around cybersecurity, the future of our healthcare workforce, leveraging technology, the behavioral health continuum, hospital finances, and payer accountability. The retreat allowed us to narrow our focus on key priority areas, including 2024 legislative initiatives for the development of our advocacy agenda. I look forward to sharing more with you in the coming months. I also want to thank all our members for their engagement, advocacy, and dedication during the 2023 legislative session. Together, we have successfully built and strengthened relationships within the Florida legislature, allowing us to better tell the hospital story. The FHA 2023 legislative summary provides a detailed account of session outcomes with a focus on 5 major areas: workforce, the state budget, behavioral health, payer accountability, and Florida's regulatory environment. I'm proud to say that our proactive legislative advocacy strategy was a huge success. As we all know, far better to be on offense than defense. Last week, we saw significant changes to the employment requirements around COVID-19 vaccines at the state and federal levels. We've sent out a number of issue briefs on this topic. CMS, the Centers for Medicare and Medicaid Services, released a final rule that withdrew the federal COVID-19 mandate for healthcare staff and reinforces the importance of quality reporting to encourage staff to participate in vaccinations. This is very similar to the approach to flu vaccination reporting requirements. On June 1st, SB 252 regarding the state prohibitions on COVID-19 vaccines became effective. The law now specifically prohibits businesses from using vaccination status as a condition of employment and contracting. Really important that we understand and now reconcile the difference between the previous Florida law and the one that was just adopted. It is now an outright prohibition on vaccination requirements related to COVID-19. It also prohibits masking requirements, but allows exceptions for healthcare facilities that follow yet to be established rules. We have been working with the Agency for Healthcare Administration regarding their plans for rulemaking. The FHA team will continue to monitor updates at the state and federal levels and share more information about these regulations going into effect. FHA also recently hosted a legal and compliance roundup webinar this week. We had incredible attendance from staff from around the state. Over 90 individuals participating. We'll continue to provide highlights from these new laws and certainly any further action out of the governor's office. Additionally, the much anticipated initiative that we have pursued with the Ohio Hospital Association related to the health plan payer scorecard has officially commenced. And I encourage those of you who have agreed to participate to submit your data. This is going to allow us to provide better data to you, to policymakers, about some of the policies from the plans and their impact on timely access to health care. It's also going to give you perspective on how these plans are interacting with you through contracting, etc. Finally, we are also hosting the Quality Conference, the Florida Hospital Association Quality Conference on June 22nd and 23rd. Really encourage you to send staff to participate or come attend yourself. Registration information is at the end of this email. And as you are also aware, we have serious concerns with a lot of the discussions occurring now in Congress. many issues surfacing that relate to hospitals, in particular focused on tax-exempt status for hospitals, transparency. Recently, we had a chance to help support one of our members actually speaking to a United States Senate committee, and Matt Muhart from Memorial Healthcare System actually went and participated in a roundtable conversation. And the purpose was to really try to provide a little more of the other side of the equation. This is really focused on the work that hospitals have been doing in Florida to provide meaningful information to consumers, particularly about their out-of-pocket costs. So delighted that we were able to get someone from the hospital perspective to join that roundtable discussion. We will share more as those issues continue to evolve in Washington, D.C. I look forward to connecting with many of you. We've been having regional CEO roundtable discussions. We have a handful more that will be occurring at the end of the month. This is your association. I want to get your feedback. We'll share updates on a lot of critical issues, but want to hear from you as well. Where are some of the priorities for you? What are some of the friction points? How do those help to inform our policy priorities, our educational programming, and our communications? Again, we try to send a lot of this information out to you in various issue updates, provide information through our Pulse, and recently, of course, through our Capital Update. Please don't ever hesitate to reach out if you have any questions or comments or specific requests that you need of your association. Thank you for all of your support and continued engagement.